Good afternoon, everyone, and welcome to the fourth edition of the Women at Work series, Women in the Health Sector.
We are delighted to have with us today Dr. Muna Abdulrazak Tahlak, the CEO of Latifa Women and Children Hospital, Ms. Amal Shamlan, the Managing Partner at the Motive Center for Physiotherapy and Rehabilitation, Ms. Mia Musa, PhD candidate in the Women and Reproductive Health Department at the University of Oxford, and Ms. Susan Aiken, Chief Nursing Officer at Ark Hospital.
So my name is Shahad Al-Murattan, and I have with me here my colleague Safar Al-Malki from Al-Qasmi Foundation, and we're excited to be hosting this webinar today.
So before we start our webinar today, I have a few housekeeping items to cover about this webinar platform. If you have a question for our speakers, please ask it through the Q&A tab at the bottom of your screen.
Okay, so we'll be answering any questions at the end of the session. If we don't get to your question during this webinar, we will follow up afterwards. And the session will be in English, but if you have questions in Arabic, just write them and we'll answer them.
Also, on the top right of your screen, there is an option for you to choose how you view the webinar. You can adjust it to see all the speakers at once. The gallery view, or only the person who will be talking based on your preference, the speaker view.
Okay, so now that this is clear, let's start our session today by welcoming our speakers. Thank you so much for joining us again. And once again, why don't you guys start off by telling us about a brief thing about yourself and your career journey. So let's start off by Dr. Muna.
So I'm the starting one?
Yes.
Sure. So you just, sorry, I didn't hear what you wanted me to say, but is it just an intro and about my...
Yeah, so just give us a briefing on yourself and your career journey.
Sure. Okay. Well, thank you, first of all, for hosting me and having us here. I think health sector is, through this pandemic, everyone discovered that it's one of the very vital and most important sector, actually. So I'm lucky to say that, I chose being a physician long time back when I was in school here in Zabil in Dubai, where I graduated from my secondary, school. And then I had the chance to go abroad and do medical school in Dublin, Ireland. Did my medical school there, finished my internship, and I decided to continue into women's health. My interest was OBGYN, so taking care of women during their pregnancies and outside pregnancy. And I went to US and I did my residency, which is the specialization in women health there at Johns Hopkins in Maryland, Baltimore. And got my highest board exams, American board exams, and I came home end of 2006 when I joined Dubai Health Authority in Latifa Hospital. And since then, I've been in different roles and positions. I started as a consultant in OBGYN, then I became head of department, and today I'm, alhamdulillah, in a senior position. I'm the CEO of the hospital for women and children. Proud of that. But I still, I'm even more proud that I still do some of my OBGYN work. So today was a very busy day for me operating, doing surgeries, alhamdulillah. But in a nutshell, that's, my career.
Great. What about you, Ms. Amal?
Yeah, first of all, let me thank you, Al-Qasmi Foundation, for hosting me and be part of this panel. Interesting topic to talk about. When I said, health sector has been inspiring during the last months for everyone and showed its importance to all the community. Actually, I started my journey choosing to be in the medical sector right from the school time. And at that time, my dream was to be a dentist, actually, not a physiotherapist. But at that time, when I graduated from the school, the options in the UAE were very limited. University only existed at that time. So we had to travel abroad and continue our graduate studies. So due to the option of the location and the placement, I got the scholarship in Kuwait and ended up in the Health Sciences College. When I came back, I started my career in Dubai Hospital and Dubai Health Authority and continued there to 2001. During this time, I got my master's degree in physical therapy. And in 2001, got the opportunity to join the University of Sharjah physiotherapy program in the Health Sciences College as a lecturer. So I was teaching for almost 4 years. After that, I've decided to join again the clinical side, and I joined Latifa Hospital in 2006. So it was the same year, Mona, you have came back to the UAE. And I was supervising the rehab services in Latifa Hospital for almost 7 years. After that, I got promoted to be the director of Dubai Physiotherapy and Rehab Center, again under the umbrella of Dubai Health Authority. And where ended up in 2015 to leave the public sector, and I continued practicing and doing the managerial role in the private center that I own. Meanwhile, during this journey, we were lucky to also to establish the Physiotherapy Society as part of our professional role and volunteer role, and this is under the umbrella of Emirates Medical Association. So from 2003 till now, I'm still involved with the society.
Oh wow, very interesting. Thank you. Mira, I know your career journey is quite different, so why don't you tell us about yours?
So I did my high school here in Dubai. And then I've always had an interest also in the healthcare sector. I've always had an innate desire to care and help people. And so I pursued and did my bachelor's degree in the University of Central Florida. I did it in biomedical science. And I was still curious as to what aspect of the healthcare sector I wanted to do a career in. And so because I always had a sense of curiosity, I took advantage of the internships that were available during my bachelor's degree, and I learned that I was very interested in the genomics sector. And so I then pursued and did a master's degree in prenatal genetics and fetal medicine. And I'm currently a PhD student at the University of Oxford, also looking into genetic epidemiology of women's reproductive health diseases.
Oh, wow. Very interesting.
Thank you, Mira. And Ms. Susan, what about you?
Hi, thank you for hosting. It's good to have it from RAC, as I know I'm your neighbor.
Good to have you.
So my journey, initially I did not want to have anything to do with healthcare. I have an echo. Is there an echo here?
No, we can hear you clearly. Let's go ahead.
Okay, so I hadn't planned to be in healthcare at all. In fact, I was planning to be a PE teacher. And then one day I was walking in the street and I saw an advert for nursing. And I thought, that looks interesting, let me try. I went along, I did an interview. They said, you're accepted, you can start on Monday. And I thought, okay, let's do it. So that was the start of my journey. So I did my general nursing and midwifery in the UK. I did midwifery at St. James's. I'm sure Dr. Mona's heard of it, in Leeds. And then I came to the UAE for 1 year, back in 1983, for 1 year only. Bit of adventure, bit of fun, see the world, and I've never left. I got married, I had children, and I stayed here. So I started my journey in the UAE at Tuam Hospital in Al Ain. So I was there for quite a long time, moved up from staff nurse to nurse manager. Then I moved to Dubai Hospital, where I was the assistant director of nursing for 4 years. And then finally, I moved into RAC to do as the chief nursing officer. Along the way, I did a master's in healthcare informatics, because I was very, very interested in the informatics side. But I've been into kind of leadership and the management role. I think I chose quite early on that was where I wanted to go. As much as I love bedside nursing, I was much more into the leadership and the management role. But that's where I am now. And I've been in RAC for the last 13 years and absolutely loving it.
Oh, that's amazing.
Fantastic.
Thank you, Ms. Susan. So now for the question that I think must be asked in 2020. So has COVID-19 affected your work? And if so, how was that? I think we can start off with Dr. Mona.
Sure. I think, The answer is absolutely yes. It has affected, I think, every sector, every human being actually. But if we come to health sector and my work, definitely, we, we went through different phases, as you know, in the first pandemic and now the first wave. And now we are in the second. I mean, not as bad, alhamdulillah, but it at one point we had to stop all our electives, so there were no cases, no surgeries happening, because we were in the middle of a huge pandemic, first wave. And the hospital, Latifa Hospital, is for women and children. I had to accept men into the hospital because the numbers were getting so big. And as DHA, Dubai Health Authority, we are 3 major hospitals in Dubai and 1 in Hatta. So it's Rashid, and it's Dubai Hospital, and it's Latifa. When Rashid was overcrowded, overwhelmed with numbers, and it was mostly in men at the beginning, I had to really empty the wards for men. Thankfully, women weren't getting infected that much, or even if they got, their illness was very mild and they'd be discharged very quickly. So half of my hospital was converted to accepting men for the first time. So imagine my nurse had to deal with men they never dealt with for 35 years.
That's challenging.
Yes, extremely. But mashallah, we did so well. It was amazing. The outcome was very good. Of course, we had the support of Rashid Hospital team, Dubai Hospital team, to help us with certain specialities that, is not available in our hospital. So that was one of the major changes. And we had to accommodate so many different things on staff level. We had to send our staff outside to cover different places, hotels, quarantine places, or isolation, areas. So it took a lot of readjustment at the workplace. And of course, even, at home. I think, when people were saying we are at home and we are bored, we never had that, I have to tell you.
Absolutely.
Because we were rarely at home and we were rarely bored. And the fun part was when it was the lockdown, I was the only one who could drive in the street. No issues. Permission. Given.
Oh, that's great. So staying in the hospital environment, Susan, how has that affected RAG Hospital?
Okay, obviously, as Dr. Mona says, it's fair to say that COVID has changed everyone's focus and it's affected everybody. From us as a hospital, like Dr. Mona says, elective admissions were stopped almost straight away. However, on the upside, we did actually have an increase of deliveries because we also do obstetrics and deliveries, and there's a certain number of people in RAC travel to Dubai or Sharjah for delivery. And during COVID, they decided to stay in Ras Al Khaimah. So our delivery actually went up, which was an upside. So we totally changed our focus to becoming basically COVID centric. We weren't a COVID hospital as such, although I don't think there's a hospital in the world that didn't have COVID patients. Even though you weren't accepting them, you would get a patient into the emergency room, and if they tested positive, they were yours. But we set up a huge COVID tent in our grounds. I'm sure that our friends from our Kazmi Foundation have seen it. Yeah. So a massive COVID tent. We're screening around 1,200, 1,500 patients a day. We were going out to communities, we were going out to corporates, to factories, to schools. Like Dr. Mona's staff, we were covering airports and borders and hotels, completely changed the focus. But the staff rose to the challenge. Obviously, the emphasis suddenly changed onto infection control, education, PPE, teaching everyone, to be safe themselves, and assuring our staff that their well-being was our prime concern. we set up an isolation a department for our staff as well. We converted 2 units to negative pressure units. In fact, our maternity unit, a second one, actually became a negative pressure isolation department. So we had a quarantine facility for our staff, because as much as you try, your staff, some of them staff will get positive. You know, and we did have a few of our staff that were positive, but we set up a quarantine facility in one of our accommodation blocks, so that we could actually look after our own staff there, which was really good. On the home front, like Dr. Mona says, there wasn't much home in it. Most of our time was spent at the hospital, but I could also drive. However, I mean, for me, my family's in the UK. I haven't seen my daughters now since February. So, you know, that was quite tough. And also I tended, because I work in healthcare, I tended not to see my friends, because I didn't want to inadvertently bring something back to them and, you know, possibly infect them. So life has changed quite a lot, but inshallah, it's starting to turn around now.
Inshallah, inshallah. So it was mostly like you stay at the hospital and you visit your home sometimes. So the other way around.
Yeah, I'm sure everyone feels the same way.
Yes.
You
Thank you,
shower.
Inshallah. Miss Amal, also let us know, please, how COVID affected your work.
Yeah, I'm in the private sector, it's quite different from what Dr. Mona and Susan has described in the hospital setting. Actually, due to the lockdown, we have been through really difficult 3 months, and it was a matter of whether we can survive this challenge in this 3 months, or, you know, we may not survive it. So we had to do a lot of changes in our financial plans and, you know, cut costs. We had to make difficult decisions, unfortunately, you know, with regard to staff. And that was a major thing that COVID has affected us in our practice in the private sector. And at the same time, we could see, you know, we were getting calls from patients who have been recently operated, who needed the service to happen, you know, the soonest the better, or they are in severe pain. So that was really a big challenge, how to receive them or how to provide them with such service, though people are talking about telehealth, but in physio really doesn't really work as efficient as, you know, with, let's say, a physician consultation or any other type of consultation. So we had to work hard on, you know, getting the trust of and the confidence of the patients to come back, putting a lot of precautionary measures, and as per the DHA also guidelines and policies that they have instructed us with. So slowly the situation became better, and alhamdulillah, now it's almost going back to normal level of practice.
Alhamdulillah. So Mira, I know it's a different case for you. Has COVID affected your research, or has it been a blessing?
Actually, it has been a blessing. COVID-19 did not affect my research. I was thankfully in the phase of my PhD where I've already completed data collection and completed all the bench work for my genomics section of the lab. So I didn't need to technically leave the house. All my work was based on at home, on the computer. I was able to hold Zoom calls with my professors in Oxford and Harvard. So it had no impact in my thesis per se. And it also gave me a lot of opportunities to collaborate with other research scholars on the COVID-19 research. So I'm also involved with COVID-19 research in the UAE with Khalifa University, the UAEU, SLIHA, Department of Health. So we work very closely with them. And it's been a great privilege to work alongside research scholars in the UAE in the COVID-19 sector, and be able to give back to the community and help in some way with this pandemic.
That's inspiring.
So we'll start the personal questions now to each one of you. So we'll start with Dr. Mona, question to you. Do you credit any individual, institution, or program with supporting you on your path to leadership?
For leadership, I think, I would say definitely being here at home, my whole dream was coming home being a consultant, OBGYN. To be honest with you, I never thought that, I'd be today in this position. But I would say the credit goes to my leaders, my direct, the CEO that I worked with, my head of department, starting with when I was a consultant, Dr. Mary Joan. She left back to US, but she was then the head of department. And she saw very early that, I could be the person who would, take that post, and she prepared me for that. Director generals that we had in Dubai Health Authority, starting from Qadi Mroshid, Isa Al-Maydour, His Excellency Al-Qatami, Maali Ahmed Al-Qatami, all of them really extremely supportive. In fact, one of the programs that I got into was the leadership program by, the Mohammed bin Rashid leadership program, an amazing program. And this was actually a suggestion by His Excellency Isa Al-Maydour when he was the DG. So what I want to say is we have great programs in the country, and somewhere made specifically even for healthcare sector by Dubai Health Authority and by international organizations. One of them is the International Hospital Federation. They actually came to Dubai and they had a specific program for leaders in healthcare sector in DHA. So all these opportunities come when you have the right support. And I want to say it's our leadership support starting from our country leaders, Sheikh Mohammed bin Rashid, Sheikh Khalifa, all of them, when they support us and they put down these programs, this is how they help us, go forward, build our career, and become better leaders.
Ms. Aman, what about you? I think you also in a leadership position. So do you credit any individual or institution or program?
Well, I would like to acknowledge again the team that I worked with for 7 years at Latifa Hospital. And here I'm talking about the team that I was supervising, at the same time also the leadership in the hospital, because at that time I was privileged to be nominated to compete for the Excellence Government Employee at the level of DHA, where I have been awarded for that, and I got the opportunity also to get into the stage for at the Dubai level of the competition in the excellence program, and I got the opportunity to be awarded by His Highness Sheikh Mohammed bin Rashid himself. So that was a big step that I'm proud of, that I have achieved, but I would credit here and acknowledge the team that I worked with, because again, to produce those results that I have submitted in my file, it wouldn't have been happened without the team that I have worked with. So here we need to ask ourselves a question: who creates the other? Is it the team that creates the leader, or the leader that needs the team, and who creates that team around him or her? So I would say that we complement each other, and without them, I wouldn't get that opportunity to be awarded for that award. So I must have acknowledged them now here.
Thank you, Ms. Amal. Ms. Mia, question to you. Tell us about your PhD topic and the reason for choosing it.
So my PhD project looks into, I did a population health data and hospital-based study into epidemiological conditions of gynecological diseases. So I looked into phenotypic profiles, symptoms, risk factors of chronic benign gynecological conditions. And my interest into pursuing into focusing in this regions because there's a lack of research being conducted in this region in women of Arab ancestry. And so part of my project, I'm working with a few institutions worldwide where we're facilitating, alongside the WRF Effect and Harvard University, we're facilitating a worldwide study on women's health, looking into epidemiology and genetics. And so my PhD focused mainly on the Middle East. And so I collected epidemiological data and genetics. And for my genetics, I collected saliva samples from women with endometriosis. And we are able to target the genetic markers that are associated with this condition in this specific ancestry. So this was my PhD project.
Oh, wow, very interesting. Susan, what are your main duties and responsibilities as the Chief Nursing Officer?
Oh, it varies every single day. So officially, I'm responsible for the nursing department as the Chief Nursing Officer, but I'm a member of the executive committee, which basically means I'm responsible for running the hospital. And as Dr. Mona knows, CEO is a very busy job. So I report directly to the CEO, but I also have another title, which we like to call myself CEE, which is Chief of Everything Else. So I should use that one. So it seems that everything else that's not by the CEO really comes to me. I'm also responsible for the soft services in the hospital. So the kitchen, the catering, the housekeeping, the laundry, we have a spa, they all report to me too. So obviously, it's with nursing, it's about patient care, maintaining standards, writing policies and procedures, ensuring hiring, retention, education. So there's just so much more. It's basically running a hospital along with the CEO and the Chief Medical Officer. So
I have a follow-up question. Susan, how do you motivate your nurses?
Okay, good question. So basically by being present, by being there and being available. So I think if you're sitting in your office all the time, you don't really motivate people. I'm on the units all the time. I'm walking around the hospital. So I'm very, very present. In fact, the whole of our leadership is always present. We do rounds every day. The CEO, myself, the medical director, we're out on the units. We're seeing all the patients. We're talking to the staff. We have an open door policy, and we really encourage the staff to come and see us all the time. So if they have any issues, it's a very open door. We have reward and recognition programs so that if someone, if a patient has a really good feedback about somebody, then, we do recognize that person publicly, on various forums. We do our annual day celebration so that we can recognize staff as well. So I think, like I said, just being present, being seen, being there. I'm sure Dr. Mona can relate to that. You have to be available, yeah?
Thank you so much. The question to Dr. Mona, so you've been in the academic field. How did you transition in your career from being hospital administration into academia?
So, I think part of our training is that, you learn from physicians and you're learning from nurses and others. It becomes inherent in you that, you also continue teaching. So when I joined DHA, part of the responsibility initially, before becoming into this heavy administrative post, I took up actually the director of residency program for OBGYN, which means the same training I had to go under in US, we had something similar here in Latifa, and I was directing that. So training and teaching residents was something that interested me always. And then, of course, medical students are there. So MBRU, Mohammed bin Rashid University for Medical Science, also, was an area, was a university that attracted me to teach medical students. So today we have here in Latifa medical students that come from MBRU, from Dubai College for Medical College for Women. We have residents who are after their medical school doing their training. It's a passion, it's an interest, You know, I'm so happy to hear Mira and the PhD that she's doing. It's amazing, Mira. You know, as you said, research is something we lack, unfortunately, in this region. And we are then depending totally on things from, you know, other parts of the world, which is not fair. I think, you know, we have the resources, we have the means, and today we need people who have that interest to develop research in the region. So, and endometriosis specifically, you know, it's something I think it's really, you're working on it. It's amazing. I'd love to, you know, at some point when you publish your papers to look at it, because this is amazing. So it's a passion. You have to teach to stay actually updated. So you know, I have, so for example, and now in my busy, you know, work as an administrator, 2 days of my work is one day when I sit in my clinic, and those days I make sure that I have a resident with me. So she is, you know, just learning directly from me how I manage patients, how I see them, and how I treat them. And then in operating rooms, also when I go on Mondays, is when I have a resident or another doctor who's helping doing the surgery, so we can teach and train. So, you know, it's something embedded, I think, in our work. And I love it.
Oh, that's so nice. Ms. Aman, this question is directed at you. So at your current leadership position, what are some strategies that you've learned along the way that could help more women achieve such a role?
Well, you know, running a private practice it means that you need the health parts, you know, knowledge and skills is not enough at all. So there are a lot of elements in managing a private business that needs to be learned and be expert in it, such as, you know, finances and marketing. So we had to learn along the way how to, you know, manage the financial aspects, learning some of the accounting principles there, and marketing strategies. So that really has added to my you know, knowledge of to be successful in such practice. At the same time, being an administrator or a manager in such a practice doesn't mean that we, you know, to give up the clinical work. So, as Dr. Muna said, you know, it's advisable to merge between the two, and because playing the clinical role as a clinician will open your eyes to what really the client would need when they come to such practice. What are the you know, small details that they may face, you know, while during their journey, or you know, at the reception desk, or getting the service there. So it's and the interaction itself that happens during, you know, the service provision itself gives a lot of insights to improve the practice that we do.
Wonderful, thank you. Question to you, Mira. What's the MAA project, and how have you established and managed this project?
Firstly, thank you very much, Dr. Muna, for your kind words about my thesis project. I really appreciate it. I'll definitely share the manuscripts that I'll be publishing. And I'd like to, if you're interested, of course, involve you more into the MUDA project. And basically what the MUDA project is I facilitate a women's health cohort to collect vital health data to investigate phenotypic profile and risk factors of gynecological conditions in women of Arab ancestry. So to date, with the help of Al-Qasimi Foundation, I was funded by Al-Qasimi Foundation to facilitate this project, of course. And we've collected around 2,600 questionnaires. I've had 2 research assistants funded also by Al-Qasimi Foundation that are medical students in Ras Al Khaimah Hospital, and they've helped me greatly to achieve this number. We've collaborated with a few hospitals and clinics across the UAE, and we held a few seminars to be able to collect this data. And I hope that as I excel in my career, I built this cohort and be able to look into more epidemiological studies. I'm also in collaboration with Khalifa University to do genetic studies. So like you said, Dr. Monet, due to the lack of research here, when I attend conferences with pharmaceutical companies, for instance, Bayer or Ferring, they always speak about genetic markers linked to European women and not Arab women. So we always see an issue with this because sometimes medications work for European ancestry women and not to Arab women. And so I hope that collaboration networking is having seminars like this that collaborates with colleagues and also attendees who are interested in this, of course, to facilitate a larger project and be able to collect a larger sample size to be able to have a role in the women's health research in the Middle East.
Oh, Mira, as an Arab woman, I thank you for your research. So, Susan, this question is for you. You have been working as a nurse since 1993. Around the UAE, you've mentioned you worked in Al Ain and then Abu Dhabi, Dubai, and now in Iraq. So what changes have you seen in the UAE's health sector during this period of time?
Yeah, actually, I came in 1983, not 93.
Oh, I'm sorry.
I was very young. I like to tell people I came when I was 12, but not quite. So I think one of the biggest changes, when I first came here, I mean, obviously Tuam was set up as a special project by His Highness Sheikh Zayed bin Khalifa, not Khalifa, sorry, Sheikh Zayed. And at that time, lots of patients went abroad for treatment. I mean, anything that was more sophisticated, patients would go abroad. And I think this is one of the biggest changes happening in the health sector in the UAE, that now it's very rare that patients have to go abroad for anything. We have every specialty that we need here. We have collaborations with experts like Johns Hopkins and Cleveland Clinic, and we have great PhD students that are doing amazing research. I think to me, that's one of the biggest changes, that the UAE is self-sufficient in healthcare. People don't have to travel abroad. And to me, that's the biggest change that I've seen. Obviously, there's lots of other things, especially women in healthcare now. When I was in Al Ain, we had the university next to us, the medical students were training there. And always the female students shone far more than the men. No offense, sorry, but they did. They were so dedicated, and it really seemed like they had something to prove again. You know, and now we see it. We see doctors like Mona, we see Amal. You know, the women of the UAE are really, really coming forward. They're really taking the lead in healthcare. And to me, that's just amazing to see. I've got 2 daughters who are engineers, and it's so empowering to see the women in this country really taking the lead in healthcare. So those are the biggest changes, I think.
Thank you. All right, let's move on and take a few questions from the audience. So some of the questions we received in the Q&A chat, probably the first question is, what was the best or the worst career decision you have ever made? I don't know, maybe Dr. Mona, you can start.
Sure. I think I would say one of the best career decisions I made was to go to Johns Hopkins in the United States. That was a big jump for me. So you know, I was in Europe, I was in Ireland, and then I did go to UK for a couple of years, but that was a decision I took, but I'm glad that I did that because it did add a huge value to where I am today and in my training. It was one of the best places in the world that was training in OBGYN. So I would say that was one of the best decisions I made. As far as the worst, I don't think, you know, there is worse. You do take to be honest with you, I don't think I have any worse decisions. Yeah, sometimes you regret that maybe you should have done, you know, this earlier or that later, but it all adds up. It's of great value. All the training that I went through, all the countries. By the way, I was abroad for 16 years. And that's inclusive of my medical school, my postgraduate training, my boards and everything. And you know, and since I've been home, I'm in Dubai Health Authority, one of the really best organizations, I have to say. in Dubai and also in UAE for providing healthcare, and I'm really happy.
Okay, so this question is for Miss Emma. We have a question. This girl says, I'm 17 and since a young age I was intrigued with physiotherapy. As a young female who's planning to study in the field in uni, what pointers can you give me that will help my career?
Well, happy and glad to hear that someone is interested to do physio. Actually, since right now in the country there are 3 schools teaching physio, University of Sharjah Gulf Medical University and Fatma College. So the opportunities are there to join any one of the schools locally here, or if she decides to travel abroad, that is another option also. One of the advices I would bring out here that doing the undergrad program in physiotherapy doesn't mean that this is the end of the learning journey. It's the undergraduate programs will provide or qualify the students or the graduate with the keys only to to specialize in the wide fields of physio. Again, physiotherapy, when you graduate, similar to the medical school, you now the trend is for specialization, and it's there. And different multiple specialties are there, from musculoskeletal to neuro to pediatric to cardiorest to women's health to, and name it. People are going now even to specialize as physios and even in hand only as hand therapists. So I would say that be ready and be prepared to graduate and be a specialist in one of the specialties that she or he, I don't know who asked the question, will be interested in. And continuous learning is a must here. So it doesn't stop at the graduation at the university. So continuous professional development is the, I would say, is the weapon that each graduate would take it to succeed and be successful in the career, because there is no way as a healthcare professional that you will be successful without continuous learning and continuous education.
Absolutely. Thank you. Thank you so much. So question for Ms. Mira. What are the challenges you face delivering quality care or conducting research in such a multicultural environment as the UAE?
I think the main issue that I had when I first started my PhD was obtaining ethics approval and obtaining a grant, and which is why I am very, very grateful for Al-Qasimi Foundation that saw potential in the project and allowed to fund this research project and allowed it to get to the phase it is at this moment. I think that was the main challenge. And when it comes to ethics, I did face a lot of difficulty initially with my genetic samples. I was not allowed to, for instance, send my genetic samples to Oxford to proceed with research there. But is a good thing, because this only led me to collaborate with Khalifa University, and I worked very closely with the team there, and they had just as good of a technology there. So I think when we look into the UAE, it is advancing very, very well. I think it's important to attract more young women and men that are interested in research to pursue a career in this, whether it is in women's health research or any other factor. And when it comes to the multicultural environment, I think that actually is really good, because it does encourage participants to participate in projects. I had no issue in approaching the women and ask them to participate in the project. The response rate was extremely high. Women were very motivated, very willing to give me information about their conditions. And so I think the main issue with the UAE right now is mainly obtaining grants to fund research projects, but having an organization like Al-Qasimi Foundation, where they do give opportunities to facilitate projects like this that can be translated into policy health, I think is a wonderful idea that will just excel the UAE in this sector.
Oh, we're glad we could help. Susan, this question is for you. What's the biggest misconception about your job?
Okay, please don't take offense, Dr. Mona. I think the biggest misconception about nurses in whole about the job is that we all want to be doctors, and we really don't. You know, nurses, because, you know, we're nurses. Nurses go into nursing because they want to be nurses, you know, and which is good because we can't all be doctors and we can't all be physiotherapists. Well, we could be, but, you know, so I think that's probably one of the biggest misconceptions about nursing as a whole. Okay, I think another one is that we basically only do bedside care. You know, nursing is so much more, it's so much more technology. If you ever, there's if you see online, sometimes there's this picture of a room and it's just like about 15 IV pumps and machines and everything. It actually says no doctor in the world could ever manage this. It's a nurse. So the technology now is so much more than it used to be, with IV pumps, with ventilators, with various machines, or everything is now online. So, you know, it's not all about bedside nursing. Obviously, the core to nursing is looking after the patient at the bedside, but, you know, it's so much more than that. And I think these are probably the two biggest misconceptions that there are, and that nurses are just based in a hospital. They're not, they're everywhere. You've got nurse educators, you've got nurses who are teaching, obviously in nursing schools, you've got nurses doing research, you've got nurses just in every aspect of life. So I think probably those.
Definitely.
Okay. So before we close, we have a final question for today's session. What advice or what is your advice to women in Iraq or worldwide interested in building a career in the health sector? We can start with you, Dr. Muna, if you don't mind.
My advice would be, you know, I think if you love this, if you like this, you know, the health aspect and the medical or nursing, you know, providing healthcare, definitely pursue it. I don't think, you know, you need anyone to convince you today about the importance of what health sector does. We saw that during pandemic. We're seeing it still. The shortage is there all over. It's always wanted and needed. There are so many, you know, advances and open opportunities there that, you know, people need to go and explore. So I think it's very vital, very important, and I would definitely say for people who are interested to pursue, not to get, you know, there will be obstacles, there will be challenges always throughout the way, but don't allow these things to put you off. It's important that, you know, what you have in mind and the bigger goal, you always have it in front of you. I'll tell you, my biggest goal was always coming home and to be able to provide care to women in my country. And that was the bigger goal. And whenever I was challenged, I had obstacles, I had to go back to that goal and keep in mind, because that's what kept me going. And along the way, you're going to find people who will help, who will support, maybe people who will not also. But when you're focused, trust me, it's easy to reach to the goal, to the bigger goal.
Thank you. Susan, what about you? What's your advice?
My first piece of advice is do your research. There's so many different fields in healthcare. You know, people tend to think it's nursing and doctors, but there are so many fields in healthcare. There's physiotherapy, pharmacy, biomedical engineering, radiology, genomics. There is just so many different research fields in nursing. So find your passion and pursue it. See what you're good at, see what you love. First of all, you have to love it. As Dr. Mona says, if you don't love it, then, you know, it won't work for you. But there's so many different aspects of healthcare that I'm sure that most people can find one that they actually really, really enjoy. So do your research, find your passion, and go for it.
Oh, thank you.
Thank you. What about you, Ms. Amal? What's your advice to women in the health sector?
Well, adding to what Dr. Mona and Susan had said, I would say that, you know, looking at our country here and looking at the cultural needs of having women in the health sector as a healthcare provider is there. So I would definitely would encourage and ask all women who would like to go into that field to do it, because our society needs that, our culture needs that. So, and at the same time, we are lucky in a country that has the government vision of empowering women and so supporting women to prove themselves in wherever they are. So at the same time, being a woman, I wouldn't say being a woman, being a mother, if the situation will bring the woman to establish a family, that shouldn't at all become a reason to not to engage and not to go into the healthcare sector, because it's a matter of planning, a matter of balancing, and a matter of prioritizing what to give. So it's okay if you give up a bit of your time, of your career, for the sake of taking care of your children or of your family. That's fine. That wouldn't stop the success in the career and as a healthcare provider.
Definitely. Mira, so what about you? What advice would you give to women who want to go into the research field? And also, what advice would you give to Arab women regarding reproductive health?
I'd like to echo what was said previously. I think the most crucial thing is having passion in the healthcare sector and having the willingness to serve the people and do what's best for the people. And as was mentioned, work your hardest, project your confidence, be persistent. I think the best advice that I've gotten being in the research field and academia field was obstacles that I've faced in the past, or situations that I've been put as an Arab woman where individuals have degraded me and my role. I think the best advice I've gotten from my parents was always lead with grace, never lead with aggression, and always push to improve the representation of women in the healthcare sector. And I think that was the best advice that I've gotten. I've always tell this to younger women, that when you are put in situations where individuals degrade you as a woman or as an Arab woman, always lead with grace, be the representation. And this is just, I'm walking in the footsteps of Dr. Muna, of Mrs. Ahmed, of Susan. So I'm walking in the footsteps of these women that have put me in this position. And I hope that in the future that younger generation can say, oh, I'm walking in the footsteps of Mira because she has paved this path for me. So I hope that the most important advice I would give is just lead with grace, be passionate in what you do, be persistent, and fight for what you want, have hope, and you'll be able to achieve it.
Thank you. Well, time has gone by and we are at the end of our very delighting and informative session.
So thank you everyone for joining us today, and for our women in the final Women at Work in the Health Sector. We'd like to once again thank Ms. Susan, Ms. Amal, Dr. Muna and Mira for joining us today and for sharing their experience in women in the health sector, and for raising awareness and inspiring all the young females to pursue a career in the health sector.
We certainly learned so much today. For those who joined us later, or if you know someone who would have enjoyed this conversation, we will have the recordings of this webinar posted on our YouTube channel and other social media platforms, and share the links with everyone who attended.
So when you leave the webinar, you will find a link to a survey for today's session. So we would appreciate if you could just spend 2-3 minutes giving us your feedback. And if this is your first event with the Qasmi Foundation, please don't forget to sign up for our mailing list and receive upcoming events.
So on behalf of Al Qasmi Foundation, thank you for joining us today, and have a great day, everyone.
Thank you all.
Thank you.
Thank you.
Bye.
Bye.
Take care.